How do you treat an ankle sprain? It's very important to determine if it's a severe ankle sprain or a mild ankle sprain. Either way, you need to adhere to RICE, which is rest, ice, compression, and elevation. Usually these patients come in with a very swollen ankle. Of course, we have to rule out, make sure that there's no broken bones underneath. If there are, they need to be immobilized. Prior to being immobilized, the swelling has to resolve somehow. We put them in a Jones compression type cast, followed by a cast. It could be a walking cast for 3 to 4 weeks. Of course, if it's an acutely displaced fracture, we have to reduce and over-reduce the fracture first, and then place the patient in a cast. We also have to assess ligament damage with the use of an MRI.